Okay, because it looks backwards to me.
Mine looks backwards too, and it also trips me out every time.
Well, I was able to find it and download it.
Perfect. Right. Well, welcome everybody to today's Health Council talk. We have our friends from Quay County here, Brenda Bishop and Debbie Ortiz from Torrance County. And then we will also have a presentation from Jeanette Pena with Paxis Institute. So we'll go ahead and get started as soon as my share screen comes back. All right. So we'll start off with our land acknowledgement. The New Mexico Alliance of Health Councils gives sincere gratitude for the opportunity to live and work here on ancestral and unceded lands that have been cared for by our state's original peoples of the Apache Nations, Pueblos, and the Navajo Nation. We honor and respect the indigenous cultures, traditions, languages, and the rich contributions that continue to shape New Mexico. Together, we acknowledge the history and impact of genocide, dispossession, colonization, and ongoing systemic inequities on Indigenous communities. As a collective, we commit ourselves to working toward justice and reconciliation, dismantling inequitable systems, standing in solidarity with and respecting relationships with Indigenous peoples. The Alliance affirms Indigenous sovereignty, self-determination, and self-governance of New Mexico's tribes, pueblos, and nations. In offering this land acknowledgement, we encourage you all to reflect on your own relationship to the traditional lands and take concrete actions to dismantle systems of oppression where Indigenous peoples are empowered and celebrated. All right, and then a few housekeeping notes. If you have any meeting information updates that you're holding regularly, if you wouldn't mind sending those to me so I can update the website. And then if you have any social media handles, particularly Instagram, because those can be really tricky to find, upcoming events, like highlight pictures, things that have happened recently. I would also love to see those if you have a second, just to help highlight your incredible work. Our last peer learning session is next Wednesday. It'll be on organizational development, business practices, government. Oh, so sorry, I cannot talk today. Governance, structure, and record keeping. So we'll have somebody with us from an HR consulting firm, as well as the CFO from Albuquerque Community Foundation. And then if you have any questions or updates for membership agreements, you can reach out to Geraldine. All right. And as promised, today we'll have health councils with us from Quay County and Partnership for a Healthy Torrance. And then we'll wrap up with Praxis Institute with Jeanette Pena. And I will go ahead and stop sharing and turn it over to Brenda. And you're muted, Brenda.
Yes. Sorry, I didn't expect to go first, so that's quite an honor. I will try to stay on time. Um, so when I was asked months ago, I was asked to talk about growth funding, and then when I got my email, it was policy and advocacy. So I've been trying to figure out how all that works together. And so today I thought, well, I'll just sort of talk to you about what I think has happened to us as far as why we've grown and things like that. So to me, advocacy sort of starts at home. It starts with your local community and them realizing how important you are to the community. And then they can therefore go out and help um, push your agendas or, fight for you. And I've seen this work in my previous job as an extension educator. And so when I started this job, I had just retired and we were a struggling council. We were down to a few members. We had very little funds, less than 20,000. We had just completed the process to become our own 501(c)(3). And then we were discussing how we could reach other groups or other people in the community. And we were already discussing how we could do hybrid meetings. So that's one good thing that happened when all this occurred. And then we were in the process, almost done, of updating a community resource directory. And then, March of 2020 hit, and we go to have our normal monthly meeting, and all these people started calling me and saying, I am just been told by my bosses I can't leave my office. I can't go to meetings anymore. I can't. And fortunately, with my connections with New Mexico State, I was able to get a Zoom set up right away, and we still had our meeting. And so that was our first into Zoom and meeting. And then from there, we decided at that meeting to go keep our meetings and to go online. So we researched and figured out what program, and then we started contacting all of our members and teaching them how to get online over the phone and how to be part of the meetings and all that. So that, we started there with that little small thing. We had a younger member who was a young mom, and she worked with young moms. And she expressed that their need was nobody knew how to get a hold of WIC. No one knew how to get a hold of ISD because everybody closed. So that's where we started at our advocacy, I guess, work, not really realizing what we were doing, but we worked really hard and made lots of phone calls, especially the people on the resource directory committee, because they were already contacting people. And we would, and because we're a small community, and it's probably easier in a small community, we know where people live, we know their names, we know. So we were able at that time, because we had local people working in our offices, to call them at home and say, hey, what's up? How do we get people help? and then we were able to post that. So then we didn't have a very active Facebook page, but we already had that. So we learned how to make better posts, used a variety of programs. Now we use Canva. We'll be glad to teach you that. But we use a variety of different things to try to create posts using this young mom's knowledge. And then we used, we learned how to get people to invite people to ours. So at that time, our social media, we really were working hard to get information out, educate people. Maybe it was, what is the current guidance, what's going on, but mostly how you could access services, because that's what we needed to be doing at the time. We grew our people pretty quickly because we taught people how to invite their friends. And then we started doing things like having the zoo people do an animal presentation as a Facebook Live, or a snake presentation. That was our most popular, was the snake presentation. And we did other education, just fun things for families. We learned how to do Facebook Live, and so we would do activities that you could do with your kids. We would do recipes. And we filmed all this stuff on my little iPhone, and we really didn't even edit because we didn't have that knowledge at that time. But it wasn't quality, but it was just stuff out there that got people, and everybody was needing something to do. So we were able to really grow. And even now, our Instagram, Facebook, and all that, our focus is locally, and 75% about of all the people on our, when you look at that, are people from our county or the surrounding communities, which that's why our numbers aren't big, but they are impactful to our community, and our social media is focused on that. The other thing we made sure when we started social media is that we don't choose sides, I guess you would say. We present education, but we present official guidance, but we don't make a statement as to sides. And that was really important for us to maintain during COVID, because we are a vaccine resistant community. I had never heard that before. We were not vaccine resistant prior to COVID. But it was important that we just stayed neutral and presented information. And we still do that on any kind of issue. We will present information about, we're trying to get a new hospital, but we're not telling people we just tell them education as to why we need a hospital, the age of our hospital, facts. We don't do. So anyway, but that's so we sort of keep it that way. That social media brought us a lot of attention statewide. And because of that, we were offered several grants because people, our organizations, our agencies had money that they needed to spend, and they needed work done, and a lot of people were not working. So we had just received prior, I think, well, right in 2020, but we probably had filled out the stuff prior to that, some substance misuse prevention, and we were offered overdose prevention work. And I was asked to talk a little bit about overdose prevention. So we were offered that, and it was very specific things that we were supposed to be doing, but that really brought us a lot of information about overdoses, about substance use. And so we were able to really switch our social media into that direction and do a lot of social media things around that to try to educate our community. And then we were able to be trained in giving out naloxone, which is important for our community, because at that time, we had a health nurse, but she was overworked, and that was the only place to get it. And then she resigned, after she just got burned out, and there was no place to get it other than us, the naloxone. So we were out doing community presentations, some over Zoom, and then that was always a challenge to get the Narcan delivered. But anyway, we just sort of built this, and we were looking at needs and what are needs, what different communities needed. So we had all that going. So we do realize that people are not all on social media, and we know that. And we also knew that our younger folks were not really on Facebook. But in our community, if you go into any group of people and you give them a survey and say, where do you find out what's going on in this community? They will tell you Facebook, because we don't have a local newspaper. Well, we do sort of, but it's a regional paper. We don't have, a local TV station. So when people want to know what's going on in the community, they go to the community pages on Facebook. So we did know that, but our senior population was not. So the radio was needing content. So we made arrangements with them to do a morning radio program every Tuesday morning over the phone. Now I go in person every Tuesday morning and we talk about things that we're doing. So, and we were reaching a whole nother population that way. Then with our health equity grant, we were realizing that we had a lot of people who had moved to the community that previously we didn't have a lot of people who read Spanish. They might speak Spanish, but they didn't read it. But we had a new population that only spoke and read Spanish. We discovered as we were doing the health equity stuff. So we hired some interpreters, and we started translating some of our paperwork, that our flyers or information that we were putting out, a lot of our social media, into Spanish. And we didn't use the things that you do online, because that's not the correct Spanish for our community. That was an issue. We did have a professor from the college translate some stuff for us, and it didn't work. So we did a radio ads and things like that in Spanish, because there is a Spanish day on the radio. So we started just trying to look, where are all the different things, and we became important to our community. And now we are being sought out by our community. They're contacting us for all kinds of different things, and that's a good thing. And when I think one of our biggest coups, I guess you would say, is when the county redid their community health plan, or whatever they call it, community plan. They named us specifically as a resource, and then in their back part as what they need to be doing to maintain the community. They named us there too as one of their priorities. And they've appointed county staff people to be members of the council. So that was like super big for us. But that just became because we were doing this resource directory. We were trying to get information out to people, and we built these relationships throughout over time. So that was sort of our start on all that. So I want to back up a little bit and tell you, way back in 2019, we were a small group. We had less than $20,000 to work with, and we had just gotten our 501c3. We did that because we were struggling to find funding, because we couldn't find physical agents. Currently, and we had a part-time employee. Currently, we have 8 part-time employees or contractors. We have an equivalent of 3.25 full-time employees. And we received over $250,000 in grant funding last year. So that's a pretty short period of time to be growing like that. So when you talk about policy, that's where we really struggled, is that we created some policies for an organization that had one part-time person, some volunteers, and very minimal bills or things to do with their money. You know, you got money, you paid your contractor, that's about what you did. So this past year and a half, 2 years, we have worked through an extensive policy policy and procedures thing. It's I don't know, 50, 60 pages long. It has forms, but it started out as, oh, we need to work on our finances and how we deal with things. But we started at the beginning, and we just realized that we had changed so much. So we have media policies and processes in place for hiring people, all these things that we didn't have. So it's like, oh, we have this grant and we have this money, but we got to find somebody. What is our process? How are we going to do that? So I know that's probably not the policies that you all were thinking about when you said we were going to do advocacy and policy, but I think it's really important that we start back with ourselves too, and make sure we have good quality policies in place, so that we as an organization are transparent and above board to everybody, because that keeps that reputation going, and that reputation is your best advocacy. So, so to move on to our story. So, we had all this social media going. We got these little grants. We had our resource directory done, but we still were struggling to get it out. We had it on pen drives to give out to people. But so we decided that we really needed this web page that people kept talking about. So the Alliance held a health council talks or some meeting where they had some man talking about junior funds. And so it was just good timing. I wrote to our executive committee, got permission to write a letter. And it was like a really fast turnaround because we had to do it within a week. Got my letter written. I wrote it for a web page and videos and all this stuff. And sent it off. We did already have probably several of us personal relationships with our legislators, two of them anyway. And so I sent it off. I had in my letter why we needed it. Would love to have $50,000 to continue our website. We had a small little grant to help us build it, but we knew it was going to take more than what we had. And and I included the fact sheet, but maybe because, we knew our senators, we had, in my previous job, I had known them, but we had also had them come on when we were doing some of our work with one of the little mini grants that we received. And we were talking about online as a Facebook Live, the challenges with the law that the released people from didn't you like booked and immediately released as it related to people who were involved in intimate partner violence. So we had a round table on Facebook Live. and they participated. So maybe that's, I don't know. But anyway, we sent off our letter and they only had a few days for them to figure out what they were going to do with their money. And so we were fortunate enough to receive $55,000 in junior money from Jack Chatfield. But then the challenges occurred because no one at the Department of Health knew how to deal with that. And so it was a while before we got it. And we were able to negotiate a contract with our health promotion team to spend that money because in the money from Mr. Chatfield, it just said for staff and there was no direction. But because I had outlined in this letter what I wanted to do with that became our contract with DOH, and we were able to receive our money. So if you're going to write a letter and ask for money, make sure you outline what you want to do. Another way to advocates. So from there, things started opening up. And so we would see our legislators at something. Maybe I would go at an event up at Harding County and I would see Representative Chatfield and I'd go up and talk to him and say, thank you, we really appreciate that. Or this is what we were able to do. And then we did have an event here in Tucumcari, put on by one of the private clubs, but they opened it to the public. And we were there to say to Senator Woods, thank you for all you do. And please remember health councils. But when we see them at a school ball game, we don't want to hound them, but you want to say, thank you. We appreciate all you're doing for us, and those kinds of things. And so we spent a lot of time doing that. And that's when your kids play ball in really small communities, you do often see people. And so we did happen to know Senator Woods and Representative Chatfield already. So that was sort of our advocacy, not just for our little funding there, but just, for health councils. We expanded it to all health councils the last few years. Um, so then we had that money for 2 years, and we thought, ooh, we could possibly use some more money because we had received a grant, and that grant was a vaccine grant, but we had used that for videos and editing, and we had started a podcast, and we needed funding to continue our podcast. So we wrote a letter, explained about this podcast and how this funding would, it was just a 2-year funding thing. We'd be out of funds, but this is how much it costs per podcast, about, in time. Our expenses are just in time, people, editing time and all. So we did that, and voila, we got gross funds. And then we negotiated with Department of Health, and our reporting is basically how we promote our podcast. So I think I'm probably out of time, and I've talked too much. Sorry. But that's sort of our story about advocacy and policy. Here are all of our handles. Follow us on YouTube. Check out our podcast there, or on Spotify. Check out all of our media. We have a lot.
Thank you, Brenda. Thank you so much. And for those joining, today we're just going to we heard from Quay about their advocacy efforts and policy around, getting growth funds, which is super exciting. I know this fiscal year, maybe a handful of 5 or 6 health councils got growth funds. So definitely taking advantage of those funding opportunities and making connections with legislators. I think you hit it on the spot, Brenda, right? With Chatfield and Senator Woods, having that relationship. And right, I feel like that probably must leverage why you got the growth funds in the end. So thank you, Brenda. I feel like, things all tie into advocacy. And I felt like you were a little unsure at first, but you spoke a lot about education, which I feel is very critical component of advocacy anyway. So I love that you're doing that in the community. And then you talked about navigation, right, for ISD and WIC, also being advocates and making sure people get the services they need. So we appreciate that. Just very quickly, any questions or comments in chat for Brenda with Quay County Health Council?
I just have a real quick comment. This is Debbie, and Brenda does an amazing job. It's easy to do your job when you have such champions, such as Representative Chatfield and Senator Woods. They are very community oriented, and they are in the community. And like Brenda said, you go to basketball games, football games, whatever. They're invested in their communities. So when you talk about health councils, they already know. They know what's going on. I wished every representative and every senator knew as much as Representative Chatfield and Senator Woods know about their communities. That would be amazing. Then it would make our jobs easier. But I applaud Brenda for just continuing to go up to them and talk to them and thank them, because that's really important. The governor didn't give grow funds this year, so they maybe got some money through capital outlay, which is good because they're still getting funding, but the governor did cut the grow funds for this past year. So we need to keep on top of if they are giving grow funds, because usually they get the grow funds and they have to use them like in 2 days. They have to allocate to their priorities. So it's a really dumb process because most of the communities don't realize that that money is there. So being in touch with those legislators and letting them know in advance, if you get grow funds, or it used to be, they weren't always called grow funds. Before that, it was something else. So if you get those extra funds, don't forget us. So just a heads up on that, but they're doing an amazing job in Quay County um, with the podcast and everything else. I applaud them. So congratulations on the work that they're doing in their communities.
Thank you, Debbie.
Yes, thank you, Debbie. Any additional questions or comments for Brenda? Please check out their YouTube and their socials. They are doing super awesome work. Their podcasts, their videos, their marketing, everything is super awesome. And we love highlighting them, right, Sam?
They're
So
so easy to highlight. They're doing great.
yeah, it's great. You guys could do a whole workshop on social media and podcasts, Brenda. um, but thank you so much for your time and sharing. You know, we always love to hear from health councils. And so I will pass now to Debbie and with the Partnership for Healthy Torrance. And so they're going to be talking about cannabis policies and their work around that and how that came about.
So in Torrance County, we have probably some of the biggest grow houses in the state. So we've had a couple of them through our efforts closed down because of the illegal activity that was going on. So we had the Native American grow house that had probably about 200 hoop houses, and which was way above what they were licensed and able to use in the state. And so through our county commission and through our advocacy, writing letters, getting petitions, we finally were able to get the state to come and look at the grow houses that they had. So they closed that one down, fined them. Now they've left a big mess. The wind is blowing everything, and the greenhouses are just a mess. The other grow house had illegal trafficking. So they had migrant workers that had been brought here from China, and they were not paying them. I mean, if they can bring people to work, I don't see a problem with that if they're here legally, or hire local people to do the work that they need in the greenhouses. But they were not paying them. They hired them. They told them, you're responsible for this greenhouse, and if you do a really good job, I'll give you another greenhouse, and then you'll get paid double. Well, they weren't getting paid. So somehow somebody reported them. They did a big raid. The FBI, DEA, all of these people came in, and they closed that down as well. So 2 of the big grow houses are closed, but we have several dispensaries in Moriarty. We have a very small population, but we're right off the freeway, and so we get a lot of truck traffic because of the truck stops that we have. So I think that they're strategically located so that they're not necessarily serving the people in our area, but truck traffic and the motoring public traffic are stopping to buy in our areas. Even though they're here and we have to live with them, we've been able to work with them very closely, the dispensaries, and because our concern is our community. The truck traffic and everything else, we're not as concerned about. But within our local community, we've been able to get lock boxes and put messages on those lock boxes, take them to the dispensaries, ask them to please urge people to lock up their cannabis so that our youth and just other people are not getting into it. And the dispensaries in our area have been very, very receptive to taking those lock boxes and distributing them. And when we've done health fairs, people have come up to us and said, "Hey, I got one of those boxes at this dispensary or that dispensary." So they are distributing them, and they are urging them to lock up. So we've got a really, really good relationship with the dispensaries. Um, we also have a good relationship with our um, city councils, village councils, and the county commission. Um, we've been able to get on the agendas and talk to them about. I was just at the Moriarty um, council meeting on Wednesday night, urging them if they have um, any concerns about cannabis use, because it's in our schools. And the chief of police said, we get calls every day from the school. How can you help us? And so we've been doing a lot of education on marijuana and the use, and the educating the students, parents, community on what it does to the brain and the psychosis that comes with it. So we were able to bring Laura Stack with Johnny's Ambassadors to each of our schools. She lost her son. She's from Colorado. She lost her son. Um, he was an amazing student. I mean, he had a bright future. He started using marijuana, and by the end of his senior year, all the scholarships he had received were rescinded because his grades just tanked. And so she was very concerned about him and decided that instead of going away to college, he would stay in Colorado and go to school there. And he went from just smoking marijuana and into dabbing. And so using the oils and the honey, and became more and more psychotic, and ended up taking his own life. He felt like he was being watched and tracked, and that his phone was bugged, and that every move that he was making, somebody knew that he felt like everything that he did, he was being watched. So he ended up jumping off a parking garage in Colorado and Colorado Springs. And so she was of the thought that marijuana was the same as it was 40 years ago, 50 years ago. And so when he was using the marijuana, she just thought it was a phase he was going through, and tried to get him some help, but didn't get him enough help. And so she's become an advocate for going around across the country, talking to students, parents, anybody that will listen to her about the psychotic episodes that marijuana causes. And so we brought her to Torrance County. She presented in all of our schools, Moriarty, Estancia, Mountain Air, in our high school and middle schools, and just was very open about the use of marijuana and what it does to the brain. And she has an amazing testimony. So we were really surprised at the students that came up to her after her presentation, just crying, because either they were affected in some way or another, either by using or a family member using, and them noticing the psychotic signs and what's going on. And so it was very, very moving. And we told the city council that, the students realized the dangers after she came. So it was a very good use of some of our funding to bring her to talk to our communities and our students. As far as working with our city councils and having them put laws into place, it's really hard. So when the state of New Mexico legalized marijuana, they didn't take into consideration what communities were going to have to deal with, and that so they just passed the law that cannabis, marijuana is legal, but then it's up to each municipality and community to regulate it. Well, then the community gets into the problem of we can't discriminate against a business that wants to come in. And so can we limit the amount of businesses that come in, or are we breaking the law and are we discriminating? And so the communities have a really hard decision to make. They can do it through zoning or through resolutions saying, okay, they can't be within 20 feet of a school or a church, or kind of like the liquor laws, but they have to make sure that they have every of their ducks in a row, because if not, they'll get sued, and they're afraid of being sued. And so it's just a real catch-22, but it's really affecting our youth, and it's something that parents should be more aware of. I don't know if they just think that because it's marijuana, that it's natural, the same things that a lot of people think, and don't know that the marijuana of today is 90% THC or above or below, but that it's very, very dangerous and can affect people in different ways. But the psychotic episodes that people are experiencing are just so it's very devastating to families. And so we just, we have to stay on top of things so that we know the rules and the laws. I know the legislature has been trying to regulate in some way. I don't know if everybody's aware of the trend with Delta 8 and Delta 9. Those are both legal because they're hemp derived, but then they add the THC, and they're getting away with having all of these things in our convenience stores and in just even grocery stores, the hemp products with THC. And so those don't have an age limit. And so students are coming in and buying this stuff and using it and not knowing the consequences of what they're using and how it's affecting them. So in our community, we advocate through our commission, through our city municipalities. And I know some people are having trouble getting on the agendas, but we don't have that problem. But what I suggest to anybody that is having problems getting on an agenda with their commission or their municipality, go to the meetings. They have public comment. Use that 2 minutes to say, I'm from Partnership for a Healthy Torrance Community. We have some initiatives that would help our community. I'd like to be on the next agenda. What do I have to do to get on that agenda? And so, being there, and then if there are community members that are there, they may ask you questions afterwards, and you just, it's a good place. Public comment is a good place to try to get on the agenda for the next agenda. But what else, Geraldine, would you like me to touch on?
Yeah, we have a few comments in chat if we want to start there.
Okay.
We have one from Gina, from Doña Ana. Maybe they thought that bringing business was going to be improving the community, but at what cost?
That's exactly true. And, you know, um, with more and more of our kids suffering with mental illness, this is all a product of that. COVID, I mean, it's just like it's been a snowball effect. And they didn't think it through. They didn't, they saw the dollars coming in and they didn't think about what the consequences are, and the tax that they receive from that should be coming back to the communities for prevention, for education, and it's not coming back. So we need to be advocating at the state level, talking to our representatives, just like we talk to them about what health councils do. We need to be talking to them about the consequences that we're seeing in our communities because of the legalization of cannabis.
Thank you. Thank you. Anything, Gina, on your end? You feel good? Okay. Thank you.
Yes, I just thought, I'm sorry, I had a really bad cold, but my voice is a little impacted by that. Anyway, I even before it passed, even before other states had passed their laws on this, I kept thinking of alcohol and how it had affected our families throughout the years and all that. And so I thought, why aren't we learning from this to not approve? Because now we're seeing the ripple effect, how it's affecting our communities. And I don't think it has a price on what it's affecting. You know, it's really detrimental to the whole family society. And maybe I'm too old fashioned or traditional, but anyway, that's how I feel. Thank you.
Of course. And we didn't learn our lesson, or maybe we learned our lesson and we closed drive-through windows and don't allow alcohol to be sold in drive-through windows, but they're selling cannabis and marijuana, gummies, whatever you want. They've converted the old banks into drive-ups, and so they're not carding people. They don't know if that car is full of 15-year-olds, 12-year-olds, whatever. They sell them the product. It comes to them in the air chute, like you used to, like you get your bank. If you go to the drive-through, it comes in that chute thing, and it's delivered, and they pay for it, and they're done. So they're not carding, and we should be looking at legislation to ban drive-through cannabis dispensary.
Yeah, Debbie. And then we had someone in chat as a follow-up from that, from Eddy County Health Council. Mia Peacock, their coordinator, has expressed similar concerns regarding where youth are obtaining the cannabis, where she's a college student who recently graduated high school, and she reports that parents are the ones giving the youth their supply, despite it being a third-degree felony to do so.
Yeah. And we advertise the fourth-degree felony for providing alcohol to youth or to minors, but we're not getting out that word to parents. I mean that that it's a third-degree felony, which is like a fourth-degree felony, to continue to provide any illegal substance to a minor. And so we've got our work cut out for us, but we just keep trying to get the message out. And the biggest message that we do right now is to lock it up. And so, and remind them that it's illegal for underage youth to possess it. But the schools are having a horrible time with it.
Thank you. Thank you. And we have two more comments. one from Brenda from Quay County. They're having the same issue. Also seeing an increase in homelessness since the legalization of cannabis. Joyce asked, well, there's two more questions. Has anyone figured out how to access the cannabis funds, which you might know, Debbie, a little bit about? Would that be a good option for funding?
It isn't available right now, but we need to start pushing and asking that it be that there be allocations to the communities. I would like to see it go to the health councils directly, because like with the opioid settlement, it went to the counties, and then the counties are keeping it very exclusive to maybe some of the things that they want to do, but it's not getting back out into the communities in every area. And so in Torrance County, they haven't allocated any of those opioid funding money to prevention or to education or anything else. They're just kind of holding on to it. I just need a friend. Sorry. Let me move over just a minute. I'm using somebody else's office real quick.
Thank you. No worries, Debbie. And then maybe just one more question. Do you have a good source for the lock boxes for the cannabis that you mentioned?
Yes, we do. And I don't have that with me, but I can get it to you, Geraldine, and we
Yes.
can get it sent out to everyone. We can also maybe consider doing a huge order and getting a lower price for the lock boxes. So
Yeah,
maybe we could partner and get those prices lowered. But we got a really good price. They're not too expensive. They're a cloth bag, and they've got a zipper and they've got a lock on them. And I mean, they're this is horrible, but they're smell proof as well, so that you can't smell the marijuana, because it's really like horrible. You can smell it, but it's smell proof, and it's got like little different compartments, and it can be also used as a medication box. So we've given some to elderly people in our community to lock up their medication with that as well. So, but I can get you all the information, Geraldine, and then we can put it out.
yes, let's do that. And just to let you know, Eddy County Health Council, Sarah and them are interested in maybe doing a partnered order, maybe.
Okay.
So
Okay.
we'll get you all connected. Brenda mentioned she buys them off Amazon, so they're about $20 each.
Ours are cheaper than that. I know that because our budget wouldn't. And then I can share. We have a Cricut machine, and so we do our own messaging on them, and so they're cloth, and then we put the sticker on there, and it says a lot. It's lock it up. I can't remember. Lock it up. Don't be a something. I can't remember what it says. But we use that logo, and then we have it on a t-shirt as well.
Perfect. Yeah, feel free to share any resources. We'll get it
Okay.
out after.
Okay.
And any health councils interested, even if you're watching the recording later, feel free to connect with us if you'd like to get connected with Debbie. So
Yeah.
all right. All right. I am not seeing any other questions. I'll just do a quick pause here if there's any comments or questions people would like to unmute, but that was a great discussion and follow-up comments and questions. Okay, not seeing anybody. So thank you so much, Brenda and Debbie, for your time to talk about some of your work around advocacy and policy. We have about 5 minutes left if you're all okay staying on. Just like to hand off to our partner at Paxos, just to introduce themselves, who they are, and some trainings that they offer. But again, thank you to our health councils for all the amazing work that you do and everything that you just shared. But if you'd like to connect with the health councils who presented, just connect with Sam and I, and we'll get you all connected by email or Zoom. Okay, Janet, all yours.
Thank you, Geraldine. I'm just going to share a couple of items here because I know we're out of time, but I do want to share kind of just the quick bulk of it, just so y'all are aware. So just real quick, my name is Janet Pena, and I work with Paxos Institute. And part of the reason why I'm here is because what we're doing right now is we're kind of relaunching Paxos in New Mexico. And all of the different programs that we have to offer right now are currently fully funded. And we're working with the New Mexico Office of Substance Abuse and Prevention. They're the ones that are funding this initiative. And let me go ahead and scroll right over. So I apologize for going through all these slides. This is just a little bit about who we are. We're a prevention science company. And just ultimately what that means is we research and implement evidence-based strategies for working with young people to improve their lifetime outcomes. And part of that is we all of our trainings are really rooted in these 4 primary foundations. All of our trainings are trauma informed. We teach behavior as a skill set. And part of using that strategy is that we do create those nurturing environments when we're consistently using all of these PACS strategies that folks receive when they attend training. And our end in mind is to really establish those reliable and consistent adults for our children and our youth that we're working with. And like I said, right now we're partnering with the New Mexico Office of Substance Abuse and Prevention to provide all these trainings throughout the community across the whole system of care. These trainings are available for folks that are working in the schools, in homes, in daycare facilities, people that are working with behavioral health, those out of school facilities, think Boys and Girls Clubs, YMCA, and all that good stuff. So there's trainings available for all those folks right now. And all those, like I said, are completely covered. There's no cost. And I'm going to go ahead and quickly breeze through this because what I want to show you is this QR code where you're able to see all of these different trainings that we do have available. And so if you go ahead and scan that QR code, I can go ahead and share, you can go ahead and log in and see all of the different trainings that we do have available. And you're able to kind of register and sign up for any that are that you may be interested in. What I'm going to do right now, because I know I don't want to keep you longer than you'll need to be here. I'm going to share with you a couple of links in the chat, and I will share that training event page, which is on that QR code, but I will also share a couple of flyers here for you. And then I'm going to also share my email, my personal email, so that you guys can go ahead and get in contact with me. If you have any questions, any wonderings about training, you want to schedule training for your group or for maybe some of your parents, we do have training available for caregivers. Those trainings normally run between 2.5 hours. And for those folks that are in need of those trauma-informed PD hours, this is something that is approved by CYFD. So know that that's also available for you. And I'm going to go ahead and also share this final email here. This is just a general email. If for whatever reason you can't get an answer from me, you can go ahead and email us at info@paxos.org, and you will definitely get a hold of someone at Paxos Institute to help support you with that. I know that was lightning fast, so I apologize. But if you would like to kind of meet with me or kind of, just talk a little bit more about what these trainings entail or see a sample of it, like I said, feel free to go to those training event pages. Feel free to email me, and then we can get together and kind of either a phone call or kind of like a Zoom call, kind of how we're doing right now. Do a quick one-on-one and talk a little bit more in detail about what Paxos Institute is bringing to New Mexico. Right now, we're currently working with the Teen Court Association to bring these trainings to professionals that are working with youth in the juvenile justice system. We're working with some of the schools around the different areas in New Mexico. But all of that is available to you guys at no cost. Before I let you go, I just wanted to thank Geraldine really quick for letting me hop on and come on board. Thank you, Sam, for kind of getting me started and welcoming us. And folks, I just want to say, Brenda and Deb, what a great presentation. I learned so much from both of you. I appreciate everything that you are doing. I was inspired. That's my love language, just helping the community, creating those connections, creating engagement, education. Like y'all hit all the marks. So this was definitely, even though mine was lightning fast, I learned so much and y'all filled my bucket today. So great start to my weekend. I took a bunch of notes. Brenda, I'm going to follow you on all the socials. Definitely going to check those out. So thank you so much. Geraldine, I'll hand it over back to you.
Hey, well, thank you, Janet. And maybe we could talk about doing a recording to upload to maybe Mighty Networks to share a little bit more about the program in detail. Just one of our platforms for health councils, and maybe something we can just share some information a little bit more. But we thank you for your time, sharing the resources and health councils. If you have questions and you want to connect with Janet, just let me know. I can help coordinate that. But we are over time. And so thank you again, Brenda, Debbie, Janet, for your time today. And I'm wishing you all a wonderful and relaxing weekend. Have a good Friday.